Hi, I'm John with Point Forward Physical Therapy, and today we're here to talk about the IT band. And what if I were to tell you that everything that we've been doing to treat the IT band for a long time is entirely wrong? So today I'm here with the Run Smart series. Last week we talked about the first most common injury that we see in the clinic, which is patellofemoral issues. Today we're going to talk about the IT band. The thing about the IT band is that it is the second most common injury that we see. And what's the first thing people think of when they have an IT band is, oh, I got to run and stretch it. What's different in our thinking now is that probably isn't helping as much as we thought it once was. We really thought that a lot of the IT band issues were due to a length problem where it had shortened up, and legitimately there are a few out there that do that. However, what we're finding is that the more people move, if they don't have correct activation of the muscles in their hip, the IT band gets overstretched. That overstretching then causes the pain that's associated with the IT band, and then things kind of cascade downhill from there. What we do here in the clinic is we take a hard look at those muscles in the hip and make sure they're doing their job so that that IT band is not taking the beating that it often does when the muscles in the hip don't do their job. So one of the greatest things you can actually do for those issues with your IT band is to strengthen the hip. But you have to strengthen it correctly. If you're not strengthening it correctly, you're going to flare the IT band, and it's going to make things far worse for you. Now, a lot of people have said, well, what about stretching? What about foam rolling? Those are fine. They're not going to fix the problem, has really been our experience here in the clinic, and research-wise, that's being borne out. We can foam roll till we're blue, and it may actually make those symptoms feel better, but at the end of the day, it's not fixing the underlying problem. When we talk about the hip anatomy, we've got the gluteal muscles that lay across the backside of the hip. We've got the IT band that comes down more towards the side. So it does lay over the top of those gluteal muscles that oftentimes just aren't doing their job in this situation. So the gluteals are here. The IT band is going to come off more towards the front side of the pelvis, and then it runs down and it comes into the outside below the knee. That's where a lot of times I find my patients they get that pain down lower. The other thing you can see with this is if these gluteals aren't working properly, people will swing out to the side with their hip, and they'll tend to get irritation over that big bone on the lateral side of the hip. That's your greater trochanter. So one of the things with this is when people come in and they've got a sore iliotibial band, the muscle that actually ties into the iliotibial band is called the tensor fasciae lata. The TFL, or the tensor fasciae lata, is what's trying to make up for that weakness on those gluteal muscles on the backside of the hip. So it tends to be overactive. One of the things that we're very specific about with our patients is how they do their exercises, because when you come in with an iliotibial band problem, generally that tensor fasciae lata, remember that's what feeds into that band, is overactive. So anytime you go to move or control the movement in that hip and leg, it's trying to take up all the load for the gluteals that are taking up not enough. We're very careful that the tensor fasciae lata doesn't actually contract and really create more problems for us. We use several techniques here in the clinic. We use surface EMG. We also have extensive knowledge as those positions is what we can basically put you in to make that really not a factor in the equation, and that's the way we treat it. It's one of those things that if you've dealt with for a while, it's really annoying, and it can really start to take you out of a lot of activities a lot sooner than you want to be. But it's very correctable. So if this is something that you're dealing with and you've been dealing with and you can't seem to get a grip on it, we'd love to take a look. We do free screens here in the clinic. We'd be glad to take a look and give you our opinion and give you some advice, or if it's appropriate, we're glad to start treatment. So feel free, if you're having these issues, to give us a call. We'll put the number on the bottom of the screen, and we hope to see you.